Alright, hi everybody. I hope everybody is enjoying their day. I thought I would bring you along my journey of remission. So, a lot of people sometimes think that remission is just like this great thing where, okay, cancer's gone, you can kind of live your life freely. And that's not really the case. Remission is a lot of work mentally, just making sure that you're in the right mindset to continue living, but still keeping track of your body to see if symptoms come back. So basically, while you're in remission, you're constantly still going to doctor's appointments. And since I am still within that first year of remission, my doctor's appointments are pretty frequent, so I thought I would take you along today. Today is lab day, so I am getting my blood drawn, and I thought I would just show you guys the process. The hardest part about being back on campus where I go to school is that this is where I get all of my treatments done. So I was originally being seen by student health, and then they transferred me over to the gynecological oncology department at the university. So while it's great to be back on campus, it does just remind me of everything that I've gone through. The trauma of first hearing my diagnosis, to then getting surgery done there, to getting my CAT scans done, labs, COVID tests, all of it. It's all been here. So while it's great that it's all close by and all together, it can be very traumatizing to come back. So here we go. So the Center for Care and Discovery is where I got my surgery done, and DCAM is where I'm going to be getting my blood drawn. One thing I do love about lab days is that there's no particular day that they actually want me to come in. So there's basically a standing order in at the lab where I can choose when I go. Of course, my doctors have the times that they would really like me to go. Up until this point, we had been doing labs once a month. But this particular visit was actually my first time going to the lab in a couple months. Because I was doing so well, my oncologist wanted to push back the blood work so I wouldn't be having to come as often. However, lab days usually are not that stressful because the wait time is pretty much non-existent. I can come in whenever I want, and they usually get me back really, really quickly. So your first question may be, why are they taking your blood so often? And that is what I'm here to answer. The reason that they take my blood every month and now every couple months is because there are tumor markers that they like to keep track of. For my specific type of cancer, I had an immature teratoma that was isolated in my right ovary. This is a germ cell tumor, which is a type of cancer that forms in the germ cells. Mine happened to form in the ovary, and because of that, the tumor marker that is very important for my oncologist is the alpha-fetoprotein level. We want that to be below a level 9, and pre-surgery, my level was at 60. The other tumor marker that a lot of oncologists look for is the cancer antigen 125 level. The CA 125 level, you typically want it below 35. However, mine was at a 74 pre-surgery. Now, if you are afraid of needles or blood, I would suggest that you look away. On the screen is a timestamp where you can skip to so that you do not have to watch this. I would like to say I did have a severe phobia of needles and blood when I was younger, but now with my whole experience with cancer, I can now actually look at the needle as they are putting it in my arm, which I think is a pretty big success. Getting regular labs done is extremely important for any cancer patient because the cancer antigens and tumor markers that they test for are going to be the first signs that the cancer has come back or is still in the body. So because I was so up to date on my blood tests after surgery, we were able to determine that I was in remission without actually needing any chemotherapy. I also want to reiterate how quick this process is. I actually kept in the whole entire clip without skipping anything so you guys can see how quick this technician is. I am always completely amazed at the staff at the University of Chicago Medicine because they are so open and loving with their patients. I was talking with the technician's supervisor the whole entire time, and turns out she also was an ovarian cancer survivor herself. So it was amazing to bond during that experience, and we actually kept talking for a couple minutes before I walked out. So thank you to the two of you for letting me record. You ladies definitely did not have to let me turn on that camera, but I appreciate you anyways, and thank you for always being so gentle and never hurting me. I really appreciate it. So after I leave the hospital with my battle scar, I always decide to treat myself. Because I had such a bad phobia of needles and blood, every single time I went to the doctor's, I always decided to treat myself with food. That is my happy place. It's what cheers me up. It's what brings me joy. So here I am on the bus, engaging in some positive reinforcement. It truly works. So thank you to the field of psychology. And I hope that you enjoy the scenery as much as I do. So one thing I did want to clarify before I get back to my apartment is that with the blood draws, I don't get the results back right away. So it can take anywhere from 12 hours to a week to get the results back, just depending on how busy the lab was. I was in and out pretty quickly though, so I'm thinking that the lab may not be too busy today, especially because it is a Tuesday. Look forward to the end of the video where hopefully I give you some good results. And if not, then that makes for some good content. All right, thanks for watching, guys. Bye. Welcome to visit number 2. We are back on the University of Chicago campus really early in the morning for my CT scan. On this particular day, I did leave my camera at my apartment. It was on accident, however, I was actually still able to get some really good footage with my phone. As you can see, all branches of the hospital are right next to each other. I did not go into DCAM for this visit. I actually went to Mitchell Hospital, which is adjacent to it. For those of you who have never gotten a CT scan before, this appointment is going to be much longer than a lab visit would be. These appointments have to be particularly scheduled because you have a lot of prep work to do. Before you even arrive to your appointment, you have stuff to do. 4 hours prior to your appointment, you must not be eating any sort of solid foods. Because I am getting an abdominal exam done, I am also not allowed to drink any sort of fluids 4 hours prior to my exam. Because my scan was scheduled for 8:30 a.m., they had me arrive at 7:30 a.m. The reason I had this scheduled so early in the morning is because I had to immediately run to my field site for my internship. So unfortunately, early it was. So you're going to see me weaving throughout the halls to try to get to the basement floor, which is where I am getting my scan done. Upon arrival, they do have you drink a solution. This solution is called contrast, and the reason that you have to drink this, especially for a CT scan that is of your abdomen, is because they need to be able to visualize the structures within the abdomen. Because my tumor was stage 1A, they do not do a CT scan of my whole entire body. They just do the scan around my stomach area, which is where the tumor originally was, because if it were to come back, it would be in that general area. So I am going to be completely honest with you. This contrast tastes like shit. The technician will usually offer you a Crystal Light packet to help mask the disgusting taste, and there is a lot of this solution. On the cap, there's 4 times written down, because each 15-minute increment, I have to drink a quarter of the solution. And let me tell you folks, this is not that easy. The first time I had my CT scan, this contrast did not stay down at all. It immediately came right back up. However, I am suspicious of the fact that it probably was because I was so anxious due to my recent diagnosis less than 24 hours before that appointment. So after we go bottoms up for an hour, they finally take me back to put on this ugly ass gown. Because the scan is just of my abdomen, I got to keep my pants on, and here I am changing. Now after I put on this ugly outfit that I could walk the runway in, it is time for me to get my IV. And look away now if you don't like needles. The reason there is an IV being put in my arm is because during the imaging, they will inject an iodine-based contrast in addition to the oral contrast that I had drank before so that the images are clear and accurate. One important thing to note is that in this room, it is extremely cold, but that's because when they inject the contrast, your whole entire body heats up. It's a really weird experience and hard to explain if you haven't experienced it yourself. And once the imaging is done, you just dispose of the gown and you're free to go. Alrighty, good morning everybody. happy Monday if you are watching this on a Monday. It's a Monday for me, so that's why. I'm trying to convince myself that it's gonna be a good start to the week. I am on my way to my last visit in this series of visits. So I am actually going to get my physical exam done. So they do a vaginal exam and unfortunately a rectal exam as well to make sure that everything is in place and looking good. And they will also be going over my results for my blood test and also my CAT scan, just to make sure that I understand everything. My oncologist has a whole entire team that works with her, and because she is a really busy woman, I don't believe I'm going to be seeing her today. Because all of my scans look good, they don't think that they're gonna have her pop in just because I'm doing okay. If there was something of major concern, I think they would bring her in, but if she ends up stopping by, I will let you guys know because that'll be a surprise to me. Yeah, I will see you guys at the hospital.
So I did want to show everybody what an exam room looks like. Luckily, they did not put me in the same exam room as they did during my diagnosis because they know that that would be traumatic. So here it is. It's a very small room, but all you do is just remove the bottom of your clothes and then you put this cover over top and you wait for the doctor.
Hi everybody. So it is now about a month after all of those appointments that you just watched. And the reason this is coming to you so late is because I am a grad student and I'm actually about to graduate in a month. So things are getting really hectic, and it's actually, as I'm filming this, the day before my cancerversary. I cannot believe that it has been almost a year since I was diagnosed. It's been a year. I still remember it like it was yesterday. With cancer, you never really know if you are going to experience that feeling again. So I wanted to bring you guys along the process just so you can kind of see what you would expect if you are a cancer patient and you are now in remission. What are doctor's appointments going to look like? What kind of goes through your mind during that process? And just, I wanted to give you guys some peace of mind. Because I didn't give you any of my results from the doctor's office during those vlogs, I thought I would sit down and let you guys know how everything went. Long story short, I am still in remission. Just to give you guys some concrete data, I want to let you know what the results were from my blood scans. So my CA-125 level was at a 13. And we want it to be below 35. So that one was still in a good range. And then my alpha fetoprotein level was also within normal range. It was a 7 and it needs to be below 9. And with the CT scan, everything came back normal. Luckily, my doctors actually go through the results with me at my pelvic exam, just to kind of let me know what they found, if they found anything, and kind of where we're going to go from there. And so that's where I want to talk about my pelvic exam. I met with a physician's assistant. She works on my oncologist team. She was extremely gentle, made sure she got consent before she did the exam, and was super wonderful in answering my questions. And usually I don't have too many questions, but I did have a couple, and here's why. So when I was first diagnosed, we had come up with a plan that every month for a whole year, I would be getting my blood drawn. That actually changed earlier than I had expected. After my visit in January, my oncologist had said, you know what, we're going to move it back to every other month. And so that had started changing, and for me that was a sign that things were moving in the direction that they're supposed to. After I got this pelvic exam, my physician's assistant had talked to my oncologist, and it was her recommendation that we do not do the CT scans as regularly as we were doing them. So because imaging is not the best for your body, they don't recommend any more than every 3 months. My schedule was every 4 months for the first year. And after this exam, my physician's assistant said that we are actually going to be skipping the next CT scan. And for me, while that may seem exciting, I did get a little bit of anxiety. When you're young and when you're still fresh in this experience, it's very comforting to have all of these doctor's appointments and to be getting tested constantly. My fear is that something is going to grow back and we are going to miss it, and I don't want to catch it too late. However, after talking with the physician's assistant, she did agree to check back in with my oncologist to see if another CT scan before my next pelvic exam would be necessary. Because I am improving so well and, things are really moving in the right direction, they don't want to bring me in as often. I feel good about it. However, it's okay to be nervous. And so I'm trying to remind myself that progress is not linear. I'm not going to feel amazing about the remission process the whole entire time, and that's okay. There's a lot of emotions that come and go with this, and I think it's really important to just allow them to come and go as they do. One thing that I did not touch on in the vlog because I didn't have enough time is that, again, not all of your appointments are going to be rosy and happy and exciting. My visit for my CT scan was pretty traumatic, and I'm going to explain why. I had gotten 2 CT scans done before, so I absolutely knew what to expect. However, I was not expecting to be in the room that they put me in. But when they went to take me back to get my IV done, I quickly realized that they had put me in an old hospital wing. It immediately brought back a lot for me. It reminded me of prep for surgery. I kind of had a PTSD reaction. I had flashbacks. I felt like I couldn't breathe. My heart rate was up and I was getting really hot and sweaty. I also dissociated for a bit. And what helped me through that is remembering where I am and doing some grounding exercises. Luckily, I wasn't there for too long. They came and got me and took me back to get the scan done. But I do want to be very transparent with you guys that those things can happen. We have gone through a traumatic experience. We didn't know if we were going to make it. We had no control over our situation at all. And to think that things are going to go smoothly from here on out is a little naive, and I want to just prepare you guys for whatever may happen. You may not have a traumatic response. I just want to share with you what I experienced and just to kind of humanize the process a little bit more and just let you guys know that you are not alone. So this was my remission process. I hope that you guys enjoyed. My next appointment is scheduled for July. I will be getting my blood drawn before that appointment, and I will not be getting a CT scan. Next CT scan is not scheduled yet. Once I meet with my oncologist the next visit, I will be able to have a better answer of where we're going from here. Until then, I'm doing really well, and thank you all for the love and support. If you have any questions, please leave them down in the comments below. Also, subscribe so I can keep making content for you guys. If you have any sort of recommendation, please let me know. Thank you so much for watching and supporting me, and I hope this helped you feel more connected to somebody and not feel as alone. So thank you so much. I love you guys. Bye.